You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers, so today I got to speak to the queen of musculoskeletal ultrasound, Debra Canapp. She owns and runs veterinary orthopedic sports medicine with her husband, Sherman Canapp. So we chatted about all the new ultrasound products that are on the market, and this includes ones that can actually plug into your phone and your iPad. Now these are so much more cost effective than buying a big machine, and I think are so handy and ideal for the vet rehabber. She discusses probes and which ones she recommends for musculoskeletal conditions, and we also talk about this being a skill not only for vets, but also for vet techs and physios. What I love about ultrasound is that it gives you that extra bit of information you just do not get from the traditional diagnostics that vets would use normally to get a musculoskeletal diagnosis. So now I'm talking about radiographs. So as a vet that does vet rehab, I am all too familiar with the limitations of radiographs, especially when a lameness presents that is a soft tissue injury. Before we head over to my interview, I just wanted to remind you all of the amazing vet rehabber communities we have on Facebook. They are the small animal vet rehabbers, hydro vet rehabbers, equine vet rehabbers, and the business vet rehabbers. This is where all the vet rehab therapists from all over the world meet up every day, share their cases, and ask for advice. And it doesn't matter if you have a practice and you are alone, it's just you. You never need to feel alone again. We are all here online every single day waiting for you. So come and join one of the fastest growing vet rehab communities and learn from like-minded vet rehabbers. Everyone there is wanting to expand their knowledge, learn, and grow into being the best therapist that they can be. So time now to learn from one of those amazing vet rehabbers. Over to Deb Canapp. Hey Deb, thank you so much for joining me.
Thank you so much for having me.
Deb, for those listeners that haven't heard the previous podcast that you and Sherman were on, please can you tell the listeners a little bit about yourself and how you got into the field of vet rehab?
Yeah, so it was kind of a very interesting approach. I was actually an emergency vet for a very long time. Then my family decided that they didn't want those long night hours anymore. And so I went to day practice and I absolutely hated it. I love the general vets out there that embrace it because I was not good at it. And so I wanted to do a specialty and rehab was just beginning. It was like the dawn of rehabilitation for animals. And so I was like, this is it. My husband's an orthopedic surgeon, so it kind of related really well. And I kind of went down that path and fell in love. I was a little scared because I was like saving lives with emergency medicine. And now here I am waving a light at a dog and wondering what it was going to do. And it was amazing, the bond that I found with my patients and my clients and just, oh God, helping them through those processes and healing and, even old age and OA and stuff like that. So it was an amazing concept. So I did that. And then I started getting old and my body's breaking and I can't be on the floor anymore with my patients. And I was like, what can I do to still be in that kind of sports medicine? So then I went down the road. I was the first group of people taking the ACVSMR boards and passed that. So I became board certified in sports medicine and then found my niche in musculoskeletal ultrasound. It just, when I was in vet school, I've always wanted to do ultrasound. And it was perfect. It just fell right into my lap. It's been an adventure because there's not a lot of stuff out there. So I'm kind of pioneering the field and it's been great. It's been wonderful.
Yeah, so I mean, you are known as the queen of musculoskeletal ultrasound. And like you say, you're pioneering it because it's not something that at vet school we were taught, right? I mean, I remember going through my radiography rotation and we had a little bit of ultrasound, but it was primarily doing like abdominal ultrasound. And, I remember a little bit in the horses doing a little bit of tendon, but it wasn't really something that we were really doing. And as vets, I think that we are not really attuned into soft tissues. And so most of us focus on the joints. We do the radiography, and then if we can't find anything there, it's a soft tissue injury. And so this musculoskeletal ultrasound really helps to hone in exactly what we're dealing with. So yeah, I think it's a really exciting field, and it's great that you are teaching people how to do this, and especially vet rehabbers. What are the types of things that a vet rehabber, like how would they use musculoskeletal ultrasound in their practice?
Mm-hmm. Yeah, so it's an amazing opening into a world of soft tissue injury. And I always make the joke, like when I came out of vet school, if a dog came in limping, you take a radiograph, if it wasn't broken, you're like, what do I do now? You're like, it's soft tissue. Here's some meds. Please don't come back because I have no idea what else is wrong. And this opens up the world of knowing exactly what's wrong so we can actually focus our treatment to it. And that's where the vet rehabilitation field comes into play, is that they know they can palpate the supraspinatus, they can palpate the biceps. They know that, hey, this hurts. Maybe this is the cause. And now we can direct our treatment towards that. So enter in MSK ultrasound, now you can see the lesion, you can monitor it, and then you can deem them healed and be confident to know that they can go back to their activity or sport and be successful.
Yeah, so I think one of the misconceptions about musculoskeletal ultrasound is that it's a diagnostic tool only for vets. So because vets are the ones that generally diagnose and it's a diagnostic tool, I think that some of the other vet rehabbers don't really realize how valuable it is for them, and that it's not only something that vets could learn. I mean, a vet tech that is doing rehab could use it, a veterinary physiotherapist can use it. Isn't that true?
Yes, absolutely. And so if you look at the human field, there's ultrasonographers. Nobody's a doctor. What they do is they're taught the technique and they're taught how to find the anatomy. And then they send off their images for a radiologist or a person boarded in sports medicine to read. So that is the same exact way that we can apply it in the veterinary field. So one, it could be a vet tech. It even can be a human PT that's come over to our vet world. And they can just learn and take the images. Ria Anziani, I don't know if you know her, but she's a wonderful PT that's blessed our canine world. And so she took my course. And again, you can just find the anatomy. If you feel that there's something wrong, if you're the first person, to kind of see the patient, you can send those images off. Like I do remote reads for my students and stuff like that. And then you have a veterinarian diagnosis. So PTs or techs are not making the diagnosis, but then they can monitor it. And they don't need to resend that unless they have a question, but they can get really good at it and just be like, yeah, no, everything looks great. So there's a perfect place. We need so many more people. And I really think that the techs, PTs, and veterinary rehabilitation people are the people that are kind of passionate about it.
Yeah, and having this skill, I mean, how do you think it really changes the way in which we can treat our patients and how we can practice?
Yeah, it just opens the world of knowing exactly what's wrong. It's just, so many people will just be like, we think it's in the shoulder, but we're not sure. And it's really not the shoulder. We can show that now. And we know then we can look for the neck. It's amazing because then if we use, say, regenerative medicine to treat the lesion or just rehab alone, you know what it starts off looking like and you know what it's supposed to heal. We always comment on, okay, it takes 12 weeks for tendons or ligaments to heal, but now we can actually watch it. So some dogs don't take that long and some dogs take longer. And before we only had to put them in a box, and now we can actually look at them individually and know exactly when it's right for them to go back to sport or function.
Yeah, I mean, for myself, I see the real benefit in being able to see the progression, of a case and how it's healing, like you say, because often we're just guessing, first of all, what it is, we think it is, and then we're in that position where we're trying to now make a decision, in that tissue healing, because we think what it is, are we able to do this now or aren't we? So, I really see such a benefit if you know exactly what you're dealing with. And then you can have a look and see how is it healing. Mm-hmm. And if that case is, for whatever reason, not progressing how you think it is, you can go in and actually have a look and say, well, this is why. Mm-hmm. Or, okay, this is not why. This is actually healing. Something else is going on here.
Yeah. And it's amazing because it's, I've been doing this since 2011. And, it took a little, time to get the confidence, even from my husband, right? So I'd be like, hey, the other shoulder doesn't look good. He's like, nope, he's only lame on the right. I'm like, you should look at the other shoulder. And we finally have enough data to just stand behind what I can see. And then I could teach that to people. But, we've saved so many shoulders in the sense that we treat both of them. And now the dog goes back and doesn't have an injury. Before that, they were coming back for the opposite leg because we just weren't confident, but we've just gained all that knowledge. It's a great time to enter into that kind of realm of MSK ultrasound.
Yeah, and it's the kind of tool I think that obviously you need experience with. So the more you do it, the better you get at it. Looking at the equipment that you need. So that's obviously one of the biggest investments. So in order to be able to do musculoskeletal ultrasound, the investment to get an ultrasound machine is so big. Are there any new tools that are out in the market now? You know, I've seen recently, and I actually shared this in the Small Animal Vet Rehab's Facebook group. It was a doctor, and he had this like small probe with this like cord, and he had a stethoscope around his neck, and he was like, the days of the stethoscope are over, and he takes it off and he puts this probe around his neck, you know, and and I was like, what? Like, he said, you in about 5 years you won't even know what one of these things are, and I was like, no, I mean, that's like every doctor has a stethoscope around their neck, and this probe basically plugs into a cell phone. And you know, he was using it and you know, showing if you can use it doing abdominal ultrasound, maybe a little bit of heart, and he was talking actually about physiotherapists using it, looking at different muscles and things like that, and obviously, you know, knowing about a little bit about ultrasound, I was thinking, well, like how, because like you can't look at muscles and tendons with that kind of probe, and so they're different probes. Is that something that you've seen, and is that something that you think that, you know, eventually would be something that we could use? And obviously remembering that a lot of our cases, the hair is obviously a little bit of a problem, having to shave. So, you know, extrapolating this kind of cell phone probe that he's got to animals doesn't always work.
Yeah, it was, am I allowed to say the name of it?
Yeah, yeah.
It was okay.
Yeah.
So the butterfly probe came out, I think it was last year, where it was launched in the vet space. I was actually offered to play with it before it actually came out in the vet space, actually before it came out in the human space, which was really cool. It's an amazing tool to get ultrasound patient side where it's needed, right? So it is kind of pioneering the human field. And I think it probably has a small place in veterinary medicine, but you're right, the probe is actually really thick. So the base of the probe is so thick that you can't get into the kind of nuances or bone prominences in dogs because they're smaller, maybe big dogs, but you would lose the whole entire small realm. And then the megahertz of the probe, I forgot what it was originally, but I don't think it was the quality. I talked to them about needing to increase the quality of the image just for MSK. Some people have gotten it, and I've gotten a lot of feedback as I've held it, you know, and played with it early on. And it's just the phone. It's just so hard to get the concept of the image on such a small device. And so, yes, I think price point, you know, I don't know if I think the probe is like 2,000 or something. Yeah, great, wonderful. It's a no-brainer. But people are having really a hard struggle with trying to utilize it in a good manner. So I think more of the tablet pays, like, so you can have I have a big workhorse ultrasound. It's a $100,000 machine. It has my 18 megahertz probe. You know, it's my baby. It's dying. So yeah, you want, for MSK ultrasound, you want a linear probe right here. So it has to be kind of straight. Some of the GEs have a hockey stick. I call it the hockey puck, the hockey stick. It's really hard to handle. So I really like a linear probe with a nice body. And that's the biggest thing you need. So you can take your ultrasound machine that you have in the practice that's collecting dust in the corner that's never used, and then buy a higher megahertz probe. So anything, in my opinion, 12 and higher, but 12 would be kind of big dogs, probably maybe 30 pounds or above. You would struggle on smaller dogs with image quality. And so anything, you know, from 12 and above would get you some good MSK ultrasound. But again, I think that, you know, so for people that are just entering into just MSK, so they don't do abdominal, I think the tablet base, I have one here. So this is one that actually Sherman first developed. I don't know if you can see that, but he developed the needle scope with it. And so we worked with that company for a while, and then we were just like, hey, would ultrasound be beneficial? I was like, oh, so yeah, so we finally launched the probe. I think it was just launched last month. And so we have, it's actually a 15 megahertz probe. And so, which is great. The image quality is wonderful, kind of really work with them, kind of tweaking things, and just really excited to be able to get it out there. Price base, I don't know specifically, but I think it's like 11,000. So that's something that's kind of approachable for people, not sure if they really want to do it. And the neat thing is, I have it over here, it comes with an abdominal one too. So say they buy it for MSK and they're like, crap, I can't do this, or don't want to, or it doesn't fit, they can go back and just still apply either, you know, an abdominal one, or even just the needle scope or anything like that. So it's like kind of multifaceted. That's why I like it. There's other tablet-based ones out there that are just lower megahertz. So you just lose some image quality, which I think it's so important because our structures are so tiny, which you mentioned in the beginning that, hey, when I went to vet school, same thing with me, we never saw MSK ultrasound, and it was because the probes weren't strong enough. So probably we had like an 8 or 10, and for dogs, you're not going to see it. For horses, yes, because they're huge. So that's why we always saw, equine world, and that's where I first learned. We had some equine practitioners come in, and they were talking to us about regenerative medicine, and then we're just like, well, how do you know? They're like, ultrasound? We're like, really? So it kind of all started from there.
Yeah, so it sounds like, the probes are developing. So like, I think as we go, obviously you're going to get more and more probes. So like right now, like if you had to make the investment, there is just one probe that you could get, right? That you could use on small animals, and like when I say small animals, like a smaller dog and a larger dog.
Right, so the linear is the one you have to use. If you use the convex one, you can't see the linear nature of tendons and ligaments, so it distorts them. So you have to have a linear one. Again, you could get a 12 megahertz, so say some machines, maybe that's the highest megahertz that they have because it's an older machine, which is okay to start off, but 15 and higher. So 15 to 18 is the area that I think is the best.
So obviously we're using it often for diagnostics and to see progression of cases, but we're often also using it to do regenerative medicine. Can you tell us a little bit about this and how you use it?
Yeah, so it's great, because what I do is I look at the tendon or ligament, identify the lesion, and now we're able to precisely get the regenerative medicine into the lesion. So, regenerative medicine out there is, a lot of people think it's magical. It's funny, they're like, oh, stem cells will regenerate the whole entire thing, and it doesn't work that way. They're not magical. They can't hone in on the one site of inflammation that you have identified. So you have to put the product near in the area that the lesion's in, and that's what MSK is for. So you can identify it, you can needle guide in there, and then you can monitor the progression, all for a lower price than at one MRI. So that's what's great, is that it's an economical diagnostic tool. It's precise. The detail is amazing. Like, I can see so much more on ultrasound than an MRI. And it's just, MRI is great, but it just has so many thickness of slices, and then you just miss stuff. And the detail on ultrasound, you have to almost tone down your interpretation, because that's how detailed it is. It's awesome.
You've obviously had loads of people that have done your courses. I'm just thinking as something that's quite like one of your sort of unique things about a practice of yours. Like, so you could actually have this skill, learn this skill, and other veterinary health therapists could refer to you, right, to get a diagnosis, go back to them. Is this something that's happening? Is this something that, like, once you get the skill, it's something that you can really develop, and then people will start to refer to you specifically to get diagnoses, vets or other vet rehab therapists?
Yeah, and that's how I've set up my course. So it was very important to me to only do remote reads for people that I've taught. MSK ultrasound, there is a huge, what we call an off-angle artifact. So it's basically like if you're holding a probe like this and you're looking at the tendon and you go like this, it's completely different. And you can actually make lesions yourself, right? So if I don't trust the person that's doing it or understand how they're approaching it, so the way I've structured the course and the material is a really kind of pragmatic approach where everything is lined up the same way, so I can interpret it well. So if I have someone that takes the course, that's the number one thing that they will do. If they're uncomfortable with the pathology part, so getting the anatomy, that's one, but then understanding all the pathology, then they'll send me the remote read, so they'll take all the images, I review them, and then I write them a report, kind of image-based, but also kind of sports medicine-based, just to kind of help them out with the case. And it works great. And that could be a tech, that could be a PT, or it can be a vet. And I think that works out wonderful. There's a lot of people out there that just want to take images and send them, and I won't allow it, because I can't interpret, I can't put my heart and my mind behind it, because I just don't know if they're doing the technique right.
So obviously your course was an in-person course, and now COVID is like completely thrown everyone. And so I know that now you're making a big move to get everything online. So obviously there's a lot of work that has to happen, but this is something that is obviously in the cards, and you're hoping soon to have your course all online. So for the listeners who are interested, this is amazing to be able to learn a skill like this online. So I'm sure it's a massive lot of videos and lectures and things that you have to sort of move online. And I'm guessing then you're going to have, I know with the VOSM Academy, you guys basically, so VOSM has clinics all around the world where they basically train and to do musculoskeletal ultrasound and regenerative medicine, and you guys have an amazing ability to be able to support these clinics, and so this is obviously the way in which you're going to help these people that are also doing just the musculoskeletal ultrasound course, that you can actually come online, and this is the amazing thing about technology now. So like you guys can be in the States and somebody can be in South Africa and they could be able to learn the skill and you'll be able to obviously support them online.
Yes, and that's what, so in the beginning stages, what I think around 2015 or so, I had people come into the clinic and just shadow me, but it was such an inefficient way, right? I had one person at a time, or I could do maybe two people. So then I went to like the online course where I would launch a course twice a year. But the problem was for my international students, it would be at like, 2 in the morning when I would give my 6 p.m. lecture, and it didn't work. I take a lot of pride in my course and I really want people to have the best opportunity to learn. And so that's where I kind of went on to the next approach, which then COVID hit, and it kind of, we've always been a telemedicine type of group, and COVID hit and we're just like, see, we told you, telemedicine, it's great. But do an educational platform. So that way the course is available whenever people want to. They have, a long period of time to do the course. They can take it in segments. They can say, hey, I know all of this, but I don't know stifle. Can I just take that part? So I think it makes it approachable. And that was always my goal, is to get as many people interested, an ability or way to get the course. So I'm working hard on it. I apologize for everyone that's still on my waiting list. It was supposed to be launched earlier this year, and life happens. And but I am dedicated to getting it out. So I'm hoping by close to the end of the year, maybe November, maybe first of year. I'm also a perfectionist. That's the other problem. So
I think it's a good thing, Dave. So yeah, so we'll be obviously posting in our small animal vet rehabbers group. And actually all our groups, so everyone there might be interested. So as soon as that course goes live, we'll definitely let you guys know. So obviously, you guys are hectically busy. You've got the clinic, but now you're developing the course. But I see that you guys are doing even more things online. So you launched, I think it was the beginning of this year, Canine Sports Med. You and Sherman, why don't you tell us a little bit about that, who it's for, and what you guys are doing with this new launch of yours?
So, at VOSM, we get to do our magic for our patients, right? This is our place that we can do all of that. And CSM, or Canapp Sports Medicine, is a place where we can do telemedicine. And it's interesting because we launched that before COVID hit, and it was just, we were like, oh, wow, look at that. So we can do telemedicine, teleeducation. We also, we took a section of it and put it to our sporting community. So we actually have a wall of fame showing some patients that we've treated and how they went back to sport, to kind of give people hope. And then we also have products. So like throughout of our whole entire career, there are products that there's tried and true. I just did a lecture online for Clean Run, and it's on nutraceuticals. It's supposed to be an hour. It was almost 2 because I'm a perfectionist, and there was so much I wanted to share. And but we have those products like on the site. Just it's kind of like what we give our dog. And people always ask that. They're like, what are your dogs on? And I give all the data why. So that's kind of the whole gist of it. It has a couple different sections on there, but it's basically about education. We really want to have avenues available for our owners and for our vets to learn more about sports medicine.
Awesome. So for those of you that are interested, we will put the URL in the description notes. Deb, thanks so much, and good luck with getting that course online. I think it's going to be so valuable, and I think especially globally, I know that there are a lot of vet rehabbers that are interested in doing ultrasound and learning about it. So putting it online is really opening up this as an opportunity for them, because I think having to travel to the States or having to travel for a lot of them is so difficult. So there's some positive things that have come out of COVID for me, and especially being able to teach more people. And this is a really, really valuable skill. So those of you that are interested, just keep watching the space.
Yes, thank you. I mean, again, it's my outreach. I want to be able to reach as many people that want to learn about it, and I think this is going to be the tool. So I'm really excited to get it out there.
Thanks for your time, Deb.
Thank you so much.
Bye. If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. And please, if you get a moment, head over to Stitcher or iTunes and leave me a review. It's a really lonely job being a podcaster, and so the only time I get to hear from you or know that you're out there is when I get a review. And know that I read every single one of your reviews. So to those of you that have left reviews, I want to say a very, very big thank you. Every time we get a review, it really helps to get the veterinary rehabilitation podcast out there to all the vet rehabbers all over the world. Alright, vet rehabbers, so if you are looking for more continuing education in the field of veterinary rehabilitation, head over to onlinepethouth.com. Go be awesome, guys.